Nigeria is advising its sub-regions to limit public gatherings and close bars and nightclubs over the next 5 weeks amid a spike in new COVID-19 cases. And government coronavirus task force has announced Africa's most populous nation could be on the verge of a second wave of the coronavirus, with the number of confirmed cases rising within communities over the last few weeks. Journalist Patrick Egwu joins us now to tell us more. Patrick, good evening and thank you for your time. How high is the spike in numbers?
Thank you, Tabo. I must say that the numbers are, increasing daily. The number of cases we've had, over the couple of weeks are increasing compared to what we've had like in months like in September and in August and, July. Now we are having the Nigerian Center for Disease Control and the Ministry of Health are recording high number of cases. And this could be as a result of, travelers who are coming from Europe and from other parts of the world who are traveling for the Christmas holidays, traveling back to meet their families and to spend time with their loved ones. And, people not maintaining social distancing and people not wearing fixed masks and people in some regions and people not even believing that the numbers being released by government officials are even true in the first place. So right now, at the moment, Nigeria is currently on the verge of a second, wave of coronavirus, with the new cases, number of cases we've been receiving over the couple of days.
Yeah. Now, Nigeria's Center for Disease Control recording 78,434 confirmed cases and 221 deaths in Nigeria. This, of course, having led now the presidential task force to announce these new rules. How will these new rules impact on the movement into bars and nightclubs, but also into places of worship?
Yeah, there've been mixed reaction regarding the new restriction by the federal government as a way, as part of measures to contain the spread of the coronavirus. People are complaining that this is actually the period we need to relax, we need to go out, we need to spend some time, something we haven't done since the lockdown started. So there've been mixed reaction in that regard, and the government is very serious in trying to enforce the restriction in certain areas, I must say. For example, a couple of days ago in Lagos, the government, with the help of security forces, actually shut down a popular Lagos nightclub where people actually went to club, to party, to have fun, to drink. We are in the Christmas season, of course, and they are actually gathering. You have mass gathering and people going to parties, people going to the clubs, and people not actually obeying the instruction of the government, obeying the restriction as a way of containing the virus. And I must say that in some places there are poor, restriction or poor enforcement of the order by the government as a way of containing the coronavirus. Some places people are still going to the party, people are still going for clubbing, people are still gathering and attending public events, attending social events without maintaining social distance, without putting on their face masks.
Now, 78,000, as I mentioned, a total number of confirmed cases in one of the most populous nations in Africa. When you're looking at South Africa, we're talking 930,000. How did Nigeria manage to keep their numbers this low without having gone to a level 5 lockdown like the one we saw here in South Africa?
Nigeria, of course, the most populous country in Africa with more than 200 million people. You should, expect that the number of cases should actually increase more than that of other African countries like South Africa and the rest of them. But I must say that the Nigerian Center for Disease Control, which is at the forefront in responding to the coronavirus, I must say that there have been, poor testing in some areas. We have, large-scale testing in the capital city of Abuja. We have in Lagos and other places. But there are some states in Nigeria where there haven't been, large-scale testing, of coronavirus to actually know those who have the virus to, as a way of, having the number and as a way of knowing the status. So I think that's why we haven't had, like we have in South Africa, the number of cases. There's low testing in Nigeria, and until we begin to do that, until we begin to embark on large-scale testing by the Nigeria Center for Disease Control, we are going to continue having the low number of results we are having. The low number of cases we are having compared to South Africa or other countries in Europe. And you should expect Nigeria, with the large population and the large activities going on, that we should normally have high number of cases, but that's not the case at the moment.
Now, let's talk Germany, Switzerland, joining the states that are banning flights from South Africa over this new virus strain. Is Nigeria thinking of banning incoming tourist travel?
There's no mention of that at the moment. The number of press conferences that the Presidential Task Force on Coronavirus have had and government meetings, and they haven't mentioned banning flights from the UK, just like we have other countries in Europe doing that. There hasn't been any mention of that, and we should expect that should be the next step of government, to ban flights coming from the UK and other hot spots in Europe like Portugal and Italy and the rest of them. But for now, we haven't seen any such move by the government. Maybe in the next couple of days, we could see that based on the advice of health experts in Nigeria. But I believe that should be the best move at the moment because of the second wave, not only in South Africa, but in other countries in Europe, the UK specifically, and the new strain that was discovered recently.
Now, Patrick, the last time we spoke to you, we spoke of the 300 missing schoolboys in Nigeria after that school was attacked. Have there been new developments there?
No new development at all. They've been released, of course, and the government said that there was no negotiation for their release